Hello everyone, thank you for joining me. I hope you're having a great day. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program about naturopathic medicine. Welcome to Island Wellness, a program designed to educate you about naturopathic medicine. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I've been practicing naturopathic medicine in Hawaii for the past 19 years. Naturopathic physicians are trained in the state of Hawaii and licensed in the state of Hawaii as primary care providers, just like medical doctors. Let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary healthcare system founded on the honored universal principle that nature is the ultimate healer. Its roots go back beyond the time of Hippocrates, the father of modern medicine. Naturopathic medicine's core belief is that our body has the innate ability to maintain and restore optimum health, no matter what the current status may be. Therefore, a physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability. Well, that's enough about me and naturopathic medicine. Now let's find out if it works. To help illustrate this, I will bring in a patient to share their experience with naturopathic medicine with you. Today our topic is urinary bladder cancer, otherwise known as urothelial carcinoma. Bladder cancer accounts for 3% of cancer deaths in the United States. Bladder cancer is the fourth most commonly diagnosed cancer among men. Painless blood in the urine is the most common symptom of bladder cancer. About 90% of the patients diagnosed with bladder cancer have transitional cell carcinoma or urothelial carcinoma. Another 10% of bladder cancer patients have either squamous cell carcinoma, adenoid cell carcinoma, or small cell carcinoma. In 2008, the National Institute of Health estimated that about 70,000 Americans will be diagnosed with bladder cancer, and 21% of them will not survive. Bladder cancer is a fairly aggressive type of cancer. Typical treatment of bladder cancer is surgical removal of the tumors, also known as transurethral resection of bladder tumor. Other types of treatment is radiation, and there's two types of radiation treatment. The first is called external beam radiation. That means that the radiation therapy is coming from the outside of your body, and internal radiation, where seeds are implanted into the tumor, called brachytherapy. There is also intravesical chemotherapy, where chemotherapy drugs are placed directly on the tumor in the bladder. Intravesical immunotherapy is a toxic irritant that is placed on the bladder tumor. The toxic irritant is BCG, and the BCG produces an immune system reaction that kills the tumor cells. You can also remove part of the bladder. This is called a partial cystectomy. You can also remove the whole bladder, called a radical cystectomy. And finally, if the cancer has spread to other sites in the body, intravenous chemotherapy is typically used. It is not uncommon for an individual with bladder cancer to use several of these modalities of treatment at the same time. Now let's examine which factors increase your risk of developing bladder cancer. Cigarette smoking is the #1 risk factor and increases your risk by 50%. Because bladder cancer is a storage site for waste byproducts, exposure to toxic chemicals such as dyes, leather goods, paints, printing materials, and textiles are well-known risk factors. Consuming large amounts of alcohol can also increase your risk of bladder cancer. Men are affected more often, about twice as often than females. Chronic bladder inflammation increases your risk for bladder cancer. Exposure to the poison arsenic also increases your risk for bladder cancer. Having previous treatment with radiation and certain drugs will increase your risk of developing bladder cancer in the future. Joining us today is my patient Doug. Doug is here to share his story of how naturopathic medicine helped him defeat his second go-around with bladder cancer. So Doug, welcome to Island Wellness.
Glad to be here.
Thank you for joining us today and sharing your incredible story of how you recovered from bladder cancer way back in 2005. Doug, would you tell us when you were first diagnosed with bladder cancer and what type of conventional medicine treatment did you undergo?
Well, I was diagnosed with bladder cancer in December of 2004, and I was treated by a chemical known as BCG.
Mm-hmm.
And well, the I got treated with BCG after the first surgery in January of 2005.
Okay, so you had surgery in 2005 to cut out the bladder tumor, and then you had immuno-BCG therapy, which is a toxic irritant that is placed on the tumor in hopes that that will, one, eat away the cancer, but also stimulate the body's immune system to fight and kill the cancer. And what was the first symptom you had that told the doctors maybe you had bladder cancer?
Well, the first symptoms was I had blood in my urine. You know, well, at first I thought it was kidney stones because that's what I had a year or so prior to that, blood in the urine.
Okay.
But after further tests, he found that there was no stone.
Mm.
So they did further tests and come out with tumors in the bladder.
Okay. In 2005 of May, the bladder cancer returned.
Right. Yeah. After the first surgery and the waiting period and the testing period, then they found out that the tumors had returned.
In June of 2005, you decided to come and see me to help you with this bladder cancer. Why did you decide to see a doctor of naturopathic medicine?
Well, the reason for that was because I needed to find a way to sort of assist in the conventional treatment that I was having, but I had no idea at that time what naturopath medicine was.
Mm-hmm.
But I was introduced to this naturopath medicine by my neighbor, who I think was God sent because I was searching for an answer to this question that I had about doing something for myself for weeks, days and weeks, and maybe even months. So actually, I had no idea, what
Okay.
naturopath medicine was all about.
So for months after you were diagnosed with the bladder cancer back in December 2004,
For
you were looking for something, I guess you're saying. What was that? What were you looking for?
I was just looking for something to fight back, because it totally made no sense at all, just laying around at home, just suffering and actually doing nothing.
Mm-hmm. Mm-hmm.
And
So
excuse me.
you were looking for something that you could do to fight back against the
Yeah,
cancer.
the reason for that is because my friends would come and visit me, telephone calls, some people would say that, hey, you got to fight back, don't give up, just hang in there. But how do you fight back? That was the unanswered question in my home for weeks, How do you fight back?
Okay. So you came in to see me in June of 2005 seeking ideas of how you could fight this cancer.
That's right.
All right, that had returned. Why did you choose to see a naturopathic physician at that time? Because you had used conventional medicine, the surgery, and then the immunotherapy, the BCG. What made you decide to see a doctor of naturopathic medicine and use naturopathic medicine to help you with the bladder cancer?
Well, at that time I did not know. But as I came to see you and I spoke to you and gathered more information, that actually, to me, when I think back, that was the key point in fighting back. And
I guess you're saying because conventional medicine didn't work.
well,
The first time.
I really cannot say that conventional medicine didn't work
For you.
for me.
Yeah.
The reason I was really concerned was because my doctor had told me that the type of cancer that I have has a high rate of return. And lo and behold, after the first surgery, in just months passed and it's right back again.
Mm-hmm.
So I felt that I needed to do something, but whatever it was, I didn't know at that time.
Okay. Okay.
You know.
Was the cancer that returned more aggressive than the first one?
Well, that's what he claimed because it not only had the tumors, but there were also a lot of spots on my blood vessels inside the bladder.
Mm-hmm.
So I thought that it was being more evasive, and
Mm-hmm.
other things is happening
Okay.
in the bladder at that time.
All right. The first visit you came in to see me, we talked about a lot of concepts on how naturopathic medicine and diet and nutrition could help you. What do you remember from the first visit that we had?
What I remember clearly was the fact that you had mentioned that my weakened immune system, and that's the reason why I'm in that condition that I was. And the only way to strengthen that was through nutrition and dieting. Why? Because of all the antioxidants, the vitamins, the minerals, and all that things that's in the natural food that's capable of fighting back this disease.
Mm-hmm.
And with saying that, to me, I think that was enough for me to have something to fight back.
Mm-hmm. So this gave you something that you could do.
That's right. Something that I could do for myself, in combating this dreadful disease.
Okay. Would you explain to the listening audience what type of diet I put you on?
Well, what you had put,
I recommended for you.
What you had recommended was the whole and raw food diet. Like eating plant food, mainly because of the fact that it has all the antioxidants, the vitamins, the minerals, the enzymes, and all these things to fight this disease. Mm-hmm. And not only that, but you had recommended that I stop eating certain kind of food,
mm-hmm.
Because of their end result, so to speak, what it'll turn out to be after it's digested, in terms of eating processed food, with all the chemicals and
the
steroids and the sugar and all those additives inside that were bad for your health.
Let's talk about that in a little bit. But you had mentioned, we have to increase the amount of vitamins, minerals, enzymes, and antioxidants in your diet. Which foods have the most of those 4 vital nutrients that you now eat?
The raw food, raw plant food.
Mm-hmm.
Right?
Vegetables and fruit.
Vegetables and fruit.
Okay. So you eat 1 or 2 servings of vegetables and 1 or 2 servings of fruit every day?
Well, it's hard to say 1 or 2 because that's all I eat.
All you eat is vegetables and fruit.
Vegetables and fruit.
So typically, what the vital nutrients you need, according to the World Health Organization, they state basically if we're needing to get the amount of vitamins, minerals, enzymes, and antioxidants in our diet, we need to actually eat about 15 to 25 servings of vegetables and 10 to 20 servings of fruit every day. And that's quite a bit. Most people cannot eat that much. So, and to keep those enzymes, antioxidants, and vitamins in your food, you have to eat them raw. And that's why Doug mentioned he eats a lot of raw foods. So when you cook fruits and vegetables, I know you don't cook fruits, but if you cook vegetables, you kill all the vital nutrients that are in there that the body uses to help its immune system and with other body functions to function at its optimum rate. So if you're going to eat vegetables and you want the nutrition from them, it really makes no sense to cook them because you end up destroying the vital nutrients that you want. So that's why Doug eats a lot of raw vegetables and fruits. But there's no way you can eat 35 servings of vegetables, 25 servings of fruit, right, Doug? How do you get most of the vitamins and minerals and antioxidants and enzymes from the fruits and vegetables?
By juicing. And like you mentioned, that juicing plays a very important role in the healing process because it's the building block to optimal health because of all the live content in your plant that your body needs. And on top of that, after when you juice these plants, and you consume that, it's already like it's been pre-digested. So what happens is that it enters your body and goes directly into your cells, and that way it's very effective in combating all the ailments that you have.
Right. So we talked about drinking fresh fruit and vegetable juices. That's the only way you can get all the vitamins, minerals, enzymes, and antioxidants.
Exactly.
Obviously, you don't typically cook juices. Some do, right? Pasteurization of some orange juices means that they are heating up the juice. But what did we talk about when it came to canned juices and box juices or carton juices, as well as maybe frozen juices?
For one thing, when you juice, you must consume that immediately. And like if it's in a can, it's not only the time has elapsed, but also there's additives in it, like sugar and stuff like that inside. So it's no longer natural.
Right.
There's additives in it to preserve the thing from fermenting. So when you consume those things, that's exactly what you put into your body, the things that you don't want, those additives. So it's because it's no longer natural.
Right. Plus, though, the vitamins, enzymes, and antioxidants actually start dying off within an hour of juicing. So basically, most, if not all, of the nutrients that are in canned, cartoned, or bottled juices have really no nutritional value. Advertising is an interesting kind of business and game. As long as the vitamins were in the product at the time it was produced, they can say that vitamin C is in the juice. When in actuality, when you get the juice 6, 7, 8 months later, the vitamin C is gone.
That's the reason why you mentioned that it must be consumed immediately upon making. And that's important.
That's the key.
That's the key.
Vital. You had mentioned that we talked about eliminating processed foods. So let's talk about the foods you have to eliminate. So basically, processed foods are foods that are packaged, boxed, or canned. So the main ones that we wanted to eliminate from Doug's diet was cookies, cakes, pies, pastries, chocolate, ice cream, candies, juice that's not fresh, sodas, dried fruits. Did I mention pasta, bread,
Yes,
crackers, um, white rice, potatoes, even sweet potatoes, and a few other foods, dairy products, wheat or gluten, peanuts, pistachios, macadamias, cashews, walnuts, soy, corn, to name the most of the foods. So the main reason why we want to eliminate processed foods is because they do have a lot of sugar in it. And sugars, one, weaken the immune system. And two, sugars will also make the body more acidic. We want the body to become slightly more alkaline because an alkaline body, according to theory, doesn't allow the cancer to grow, and cancers don't do well if the body is slightly more alkaline. So we talked about acid-alkaline balance before in another program, but basically our pH ranges from 1 to 14, 1 being very acidic, 14 being very alkaline. The human body is basically about a 7, but the theory is that an optimum human body pH is 7.35 to 7.45, so slightly alkaline, not a great deal of into being more alkaline. So, because if your body's alkalinity was, let's say, 12 or 13, you'd be dead, right? So we want to move it slightly alkaline, and to do that, we have to eat more fruits and vegetables, and we have to eat more fresh fruits and vegetables, eliminate the processed foods that make your body more acidic, as well as beef and pork, and that turns your body more acidic mainly because they do take a lot of acids to digest them. So your stomach releases a lot of acids, and then your body will absorb some of these acids into your bloodstream, making your blood more acidic. And that's what we wanted to avoid to help Doug beat this cancer. Doug, you also mentioned that meats like like beef and pork may have some added hormones
Okay.
like growth hormone, steroids, and estrogen. And the reason why that's not good is because those hormones actually increase the likelihood of cancer to grow. They weaken your immune system. So we want Doug's immune system to be firing on all cylinders so they can just focus at killing the cancer. So Doug, a lot of people are thinking, man, you were eating at least 50% of your diet fruits and vegetables. Doug, maybe even more than that, maybe like
Oh,
80%.
definitely.
Doug, you did eat some fish along the way?
Yes, I do.
But that's pretty much it, right? Why don't you go ahead and tell the listening audience what you eat for breakfast, lunch, and dinner?
Well, what I eat, well, let's start from the morning. My breakfast would consist of oatmeal, strawberries, blueberries, banana, and soy milk in the cereal. And my wife makes smoothie with whatever fruit that she has, apple, papaya, grapes, all whatever food that we have, she would use that. So that's for breakfast, you know. And for lunch, it's always a salad that I make, that the vegetables and stuff that I grow in my yard. But of course, there are some vegetables that it's almost impossible to grow here in Hawaii, like the celery and stuff like that, and carrots especially. It's kind of difficult to grow there, so I gotta go buy that from the market. But when we do buy it from the market, we try to buy organic type, which is costs a little more, but I think it's worth it. So that's the type of food I've been eating, and
And you eat that for dinner also?
yeah,
Okay.
and sometimes we get fish and stuff like raw fish and
Do you eat fish every day?
yeah, almost no, not almost, not every day.
Not every day.
At least a couple times a week.
Okay. So we're not telling Doug he has to become a vegetarian to do well. The main thing is that we decrease acidity or increase alkalinity, eliminate foods that weaken the immune system, and increase the amount of foods that boost Doug's immune system, which is basically fresh fruits and vegetables and vegetable and fruit juices. So, Doug, in between meals, what do you eat now?
In between meal, maybe I'll eat a fruit or nuts,
Okay.
stuff like that. But one thing that I gotta mention is that ever since I've come to see you and I found out, and among, of course, I read books that you recommended about the type of food that we need to eat.
Mm-hmm.
Since I came to see you from the very first day, I haven't eaten meat, pork, chicken, turkey, hot dog, any kind of processed meat.
Okay.
I haven't drank coffee, soda, and the number one culprit was beer. I used to love to drink beer, but I just cut it out completely. So as far as the food goes, I think that I'm abiding by what you recommend, and in fact, as long as I know what the contents are in the plant food, I'll eat it, because all plant foods have different vitamins and stuff.
That's true, right?
And that's the knowledge that one must acquire to understand what the contents are. So you know what the food values are and what part of your body will benefit. So those things are good to know. I mean, it's important to know.
Very important. And that's true. Doug probably did this naturopathic type of medicine diet the best among all my cancer patients that I've seen. Doug probably has done it 100% or very close anyway. And I believe Doug when he says he hasn't eaten any beef, pork, and chicken. Because we did talk that at the initial visit. Not that they're going to kill you, but they're not helpful in optimizing your immune system to fight against the cancer. So we're not telling you have to become vegetarian to do well, but do need to eat a lot of fruits and vegetables for sure. And fish is not too much of a problem because fish is a lot easier to digest than the meats like pork, beef, and chicken and turkey. So Doug, tell us how much glasses of vegetable or fresh fruit juice you drink every day.
Mainly vegetable juice, about 8 to 10 ounce glasses of juice, vegetable juice, and those vegetable juice can be a number of things, a number of vegetables all in the juicer,
Right.
because I feel that, like what you had mentioned, that all plant food has nutritional values. And if you can just remember that, you don't have to know exactly what it contains,
Right.
because just as long as it's edible, by all means go ahead and juice that, because you're surely going to reap the benefits from it.
Right, exactly. And you told me once before that anything that was green you would juice.
That's
you,
right.
And you grow a lot of your own foods,
That's
right?
right.
So, and you didn't care what part of the vegetable or fruit it was, you juice it.
Yeah, that's right.
Because if it was natural, it had those enzymes and some vitamins and minerals in it. You didn't care. You just juiced it and drank it.
Yeah.
And you didn't care how your vegetable juice tasted.
Yeah, because when you mentioned about greens, from what I recollect, the greens have have uh, have a way of producing what's known as chlorophyll, I believe it was, and what it does is enhances the red pigment in your blood, and that I guess what it does is it provides oxygen into your blood, and that's what we need really, oxygen in your blood circulating into your entire cellular system.
That's also one of the vital keys to beating cancer is increasing the amount of oxygen in your body.
Your blood.
Because cancers don't do well in a highly oxygenated body. And if you have more carbon dioxide in your body becomes more acidic. And I recently saw this on a public commercial done by the state of Hawaii, noting that a lot of the pollutants coming off our islands are ending up in our oceans, turning the water more acidic, which thereby promotes bad algae to grow and kills off our corals. So acidity also affects our environment too, not only our internal environment of our body. But Doug, there's two things I wanted to talk about because you had mentioned them. I don't want to let them slip away. One is beer. Right, we'll get back to that because you mentioned that you have to give that up. But the second one, and the one we'll discuss now, is I had mentioned earlier that according to like the World Health Organization, they basically recommend we eat between 15 to 25 servings of vegetable and 10 to 20 servings of fruit every day. So to eat that is very, very difficult, but we cheat by getting them through the juices. Yeah. Can you explain about how many servings of vegetables and fruits go into make 1 10-ounce glass of vegetable and fruit juice?
It's hard for me to see because my wife does that.
Okay. Okay. So, but typically it might take about 15 servings of vegetables and fruits to make 1 glass of vegetable and fruit juice. So that's how you can get much more of these vitamins, minerals, antioxidants, and enzymes into your body. Doug, you mentioned beer, unfortunately, is one of the risk factors that increase your chance of developing bladder cancer, as well as cigarette smoking. Were you a teetotaler before you met me? You just drank 1 beer a week.
Oh my! No, more than a case a week.
A case a week.
Just one. But
so, yeah, you can see Doug's laughing at 1 beer a week.
I remember you mentioned that to me about I gotta stop drinking. Stop drinking beer, and I had to ask you why. The reason you told me was mainly because alcohol weakens your immune system. Isn't that what you said?
That's true.
You see, so the whole key, like when I talk to people, I'm not suggesting that you quit completely. But what if you do things in moderation, like even eating meat, pork, chicken, whatever it is, if you eat that thing in moderation, you're going to be okay. But the problem is, many of us don't know what the definition of moderation is.
Mm-hmm.
And I sure as heck didn't know what it meant.
Mm-hmm.
I thought maybe it meant drink more beer. But if you do things in moderation, you're going to be okay.
Right.
You know. But for me, I found out that even moderation is not good enough for me. I just cut it out completely.
Did you ask me what moderation was?
No.
Okay. Because some of my patients ask me, and I tell them that my moderation is going to be very different than your moderation. So, and my moderation will be a lot less. So I was just wondering if that came up. So Doug, I told you that beer was not good for you. I told you a lot of foods wasn't good for you to eat, that you were eating weren't good for you. You had to change your diet radically by eating mainly fruits and vegetables, fresh fruits and vegetables, juicing a lot more. I actually tell my patients if you can drink 3 glasses of fresh vegetable fruit juices a day, you get A grade. If you can do 1 glass, you get a C. I think you were getting A's, right, for the first probably several years, maybe, right? You were juicing 3 times a day. Now it's down to just 2, mainly because it's been, 3 years now since then. But was this change that you made in June of 2005 using naturopathic medicine hard for you?
No, it was very, very simple to me because I can actually tell people that during the time of the suffering and the agony that I had gone through, you know, I asked myself, what is the most important thing to you in your life? You know, and that was the family, friends, you know. And if you can have that thought in your mind that people around you is important, I think your love, the love that others give you, it gives you the strength to do all the things you need to do. So for me, to eliminate beer, I thought I couldn't do that. But with that suffering and all that thought in my mind, I just said, this is it. You know, excuse me, even the food and stuff, I don't eat vegetables and fruit because of their taste. People can say, how can you eat that horrible tasting thing? But to me, I don't eat for taste. I eat because if I eat that, it's going to make me healthy and get me well. So today, taste doesn't matter to me.
Spoken like a true doctor of naturopathic medicine. Basically, a lot of my friends ask me the same question too. And I eat not for taste, like probably 95% of America does. I eat because the food is going to be healthy for me and keep me well. And that's why I eat, to stay well. And that's why you eat now too, Doug.
The whole key about this thing, the first thing we got to do is to educate yourself, just like what you said. You got to find out why I had cancer. If you don't know the why, then how come? How are you going to rectify the problem? You've got to read, you got to understand how these problems come about to correct yourself.
Because it could come back, saying, if you don't change your lifestyle.
It definitely will come back. You know, the devil will come right back and attack you. So you've got to be on guard constantly. So for me, my lifestyle change is forever. And people have told me, hey, you stop eating, how long do you expect to live?
You want to live to 200?
Just as long as the Lord will let me.
All right.
You know, when He calls me home, then I'll go. But as long as I'm alive, I'm going to be and stay healthy the best way I know how.
All right. Well said, Doug. Doug, we're going to take a little break now. This is for the segment, What's Wrong with My Food? Paul was kind enough to email his typical average breakfast. And Paul asked, this is my breakfast every day. my orange juice, my coffee, and my caramel bar. I want to know if any of this is causing the ulcer pain I have after eating this meal. What's wrong with my food? So, Paul, we're going to get back to this, your breakfast, at the end of the program. So, thank you. What do you think about Paul's diet here, his breakfast?
All I can do
Doug
is,
just laughs at you,
all I gotta do is just shake my head.
Okay. Not that we're laughing at you, Paul, but thank you for sending it in, and we'll get back to your question. But, all right. So, Doug, obviously you made radical changes with your lifestyle and diet. Eating a lot more fruits and vegetables, juicing fresh fruits and vegetables, eliminating all the foods that taste good, basically, right? Cookies, cakes, pies, pasta, white rice, breads, meats like beef and pork. But you also took naturopathic medicines too. So these are herbal medicines that basically work at strengthening the immune system and helping the liver and kidneys eliminate as much toxins as possible, as well as the bladder.
Mhm.
So, Doug, would you tell the listening audience what happened about 6 months later on December 22nd, 2005? You remember that day?
Was that the day that I called you?
You called me.
I called you, and I think it was if I'm not mistaken, it was the day before I called you that I went to see my oncologist and for a routine exam.
Mm-hmm.
And then he told me that there's no evidence of any tumors or dark spots on my blood vessels in my bladder.
Mm-hmm.
And that's what I called to tell you. So
that was impressive, right? You went
Yeah.
from having these tumors in your bladder
Yeah.
and using only naturopathic medicine, diet change, nutrition, and herbs that strengthen your immune system to fight against the cancer. In 6 months, the tumor was gone.
Yeah.
What were you thinking at that time when your doctor said the tumors were gone?
Well, I was so happy I couldn't even think about anything else. I was being happy that you did it. But I really feel that the benefit that you have, that you receive from changing your lifestyle, mainly eating, and of course there are other aspects to being healthy.
Mm-hmm.
Maybe we can talk about it later on.
Okay.
But I can say, and I think I can witness to that changing your lifestyle, your diet, will change your entire being as far as health-wise goes, because I was taking high blood pressure and high cholesterol pills for over 21 years.
Mm-hmm. And once you
Yeah.
started the treatment with me,
Yeah.
your blood pressure disappeared as well as your cholesterol levels went down to normal.
Cholesterol was the first thing that disappeared. So my doctor, as the exam went on, between 3 months and 6 months, in increments. He said, "Oh, I don't think you need to take that anymore."
Yeah.
So I looked at him and I says, "The other one is next." So he looked at me and laughed, because what I mentioned was the high blood pressure, because I was told that once you're on high blood pressure medication, that's for life.
Mm-hmm. That's not true.
That's not true. So to me, I'll prove people wrong when they said
it's impossible.
it's impossible.
Yeah.
And to me, that's my goal, is to prove that things can be done.
That's right. And that's what we see as naturopathic physicians every day. And when patients come in to see us who have hypertension, we ask them to change their diet and lifestyle, because it will, over time, lower blood pressure. So it's not a quick fix, but it is a truer fix.
Yeah. At least you doing something to
Mm-hmm.
work to that goal.
Mm-hmm.
The other thing I forgot to mention was that my knees were so bad.
Mm-hmm.
The doctor claimed that arthritis, that I needed to have surgery done, but I refused to, because I had surgery on my arm, on my shoulder.
That didn't go well? The surgery?
I still have pain here, but
Okay.
my knees, no more pain. I ran the Aloha run 2 years in a row. And I run, and today I run every morning Every morning at 4:30, I run 2 miles.
Yeah,
You know,
let's talk about your running and your exercise, because exercise is very important
very.
with helping you with staying healthy, but also if you have cancer to help battle cancer. And the reason we talked about earlier is we need to increase the amount of oxygen in your body because cancers do very poorly in a highly oxygenated environment. And the exercise program we talked about, Doug, when you came into the office in that first day in June, we talked about jogging, which you already were jogging already. And we talked about jogging for at least 45 minutes, if possible, daily. But you actually jogged a lot longer than that, right? And I have to actually tell you, you're exercising too
Too
much.
much.
Would you mind telling the listening or viewing audience how much exercise you were doing at that
I
time?
would, Dr. Uchida says 1 hour. But if you tell me 1 hour, I'm going to do 2 hours. And that's 2 hours in the morning, 2 hours at night. But the main reason for that is because as long as you understand what exercising does, number one, like you mentioned, that is the only way that you can strengthen your heart muscles
Mhm,
and your arteries,
mhm,
you know. So when you exercise, if you know that, you're going to have to do that.
mhm.
If you know that and you don't, then something is wrong. But exercising also increases circulation, you know, and when you breathe in oxygen into your system, in your lungs, and transfers into your bloodstream.
Mhm.
And you then by that time you'll be in a highly oxygenated state, like what you had said.
Right.
So just like eating green leafy vegetables, it puts oxygen into your bloodstream, and cancer has a hard time thriving in a highly oxygenated system.
Mhm.
So that's what we must do. So when you exercise, that's what it does. Furthermore, you mentioned that the only way, I mean, the only natural way to release toxins from your body is through perspiration. Is
If
that
it's
right?
inside
Yeah,
your body
it's
tissue
inside your
already.
body.
Mhm,
So that is the only way.
mhm.
So that's the reason why I exercise so long with fully clothed with a rubber suit on.
Yeah.
And that's why I lost so much weight. And you said I had to stop doing that because, you know, I figured that maybe I ought to check and see how much perspiration I'm letting out.
Okay.
The scale, the way it's graduated, you know, you can't pick up if I put just a bag of wet clothes on it.
Yeah.
But anyway, I figured out a way, you know, like I get on fully clothed and get off, you know, with
Right.
nothing on.
Mhm.
And actually, the wet clothes weigh almost 10 pounds.
10 pounds. So 10 pounds of perspiration.
Yeah,
Or maybe let's say
so,
six or
but
seven
with
anyway.
that in mind,
Mhm.
I'm thinking, boy, all the toxins are leaving my body. They're
Mhm.
leaving my body. So
Mhm.
that's the reason why I was doing that.
Mhm. And that's important because with cancer, one of the causes, right, is toxins, otherwise known as oxygen-free radicals. So they could be either coming from environments. We mentioned earlier on the program what those could be, as well as cigarette smoke or toxins from beer and other things. But Doug, this would be a good time to interject that uh, you don't want to attempt to treat yourself if you have cancer all by yourself. I would recommend you seek the uh, consultation of a doctor of naturopathic medicine because they can help guide you and prevent you from, guide you in the right direction. So please don't attempt this alone at home. Seek the medical care of a doctor of naturopathic medicine. Would you mention how much weight you lost, Doug?
Oh, you know, before I got sick, I weighed about 176 pounds.
Okay.
You know, as little short as I was, I weighed 176 pounds. Then at the lowest point, you know, when I was getting
When you were
treated,
heavy into
getting
the
heavy
treatment,
down, I was down to 128 pounds.
man, you lost close to 50
Yeah,
pounds.
but today I'm about 100, at the highest of 145 pounds.
Yeah, so I think that's a really good weight for you,
Yeah,
actually.
but going back to, you know, trying to tell people to try to take this disease upon yourself without
Mm-hmm.
any outside help,
Mm-hmm.
I don't recommend that because people come and talk to me about it, and I'll tell them what I did.
Mm-hmm.
I share only my experience as to what I did,
Mm-hmm.
but I don't recommend that you have to do it.
Yeah.
The person to go, because if you go to a naturopath doctor, they can monitor, they can recommend, you know, and furthermore, they'll get blood test results from pathologists, and they can verify what you lack in, and what you need,
Mm-hmm.
or what you need to take away.
Mm-hmm.
You know, no one individual who's not trained can do that,
Mm-hmm.
and that's the reason why they have doctors like yourself.
Mm-hmm.
You know.
That's an important point too, Doug. I never mentioned to you that you should stop seeing your urologist or
Oh no.
oncologist because they are very important. They're the doctors that can follow you, right, to monitor how your cancer is going.
That's right. So I believe that we need both. You know, I have the highest respect and highest regard for my oncology.
Mm-hmm. Doug, at the initial visit, we also mentioned that the wild card in this whole scheme of helping you beat cancer was mental attitude. Would you tell the audience sort of what we talked about in your experience with
Yeah.
positive mental attitude and
Well,
helping you fight cancer?
what you had mentioned about that healing process was the mental attitude also with all these other things that needs to be done.
Mm-hmm.
And like you had mentioned that to me that the attitude uh, has a tremendous impact on your immune system. So, like giving me an example that you have an angry, bitter person, who's always upset, is likely to be more sickly than a happy, well-being person.
Mm-hmm.
So, with going through the treatment that I was going through, I needed to change my attitude, and one of the biggest factors I feel is that your attitude's got to change where you don't place any blame on others,
Mm-hmm.
you know, except for yourself,
Mm-hmm.
you know, because I've experienced people blaming out a doctor, he doesn't know what he's doing. And that's part of a mental attitude.
Mm-hmm.
But if you have a positive attitude that says, yes, I have confidence in my doctor,
Mm-hmm.
regardless who he is, the
Mm-hmm.
caretaker, like a conventional doctor, naturopath. But that's one thing you must have, is the confidence in the one who's taking care of you, treating you.
Mm-hmm.
And that's one of the biggest aspect of attitude,
Right.
you know. And although the attitude comes from your family members also, that they need to be supportive, and your
Right.
friends who would support you emotionally, and that's important.
Right. Because if you are receiving positive feedback from your family and friends, such as they really care about
Yeah.
you, they really support you in what you do, whether it's conventional medicine or naturopathic medicine, they support your choices. But if there are people around you that they always maybe try to sabotage you,
Yeah.
telling, oh, you're wasting your time with
Oh,
taking
yeah.
vitamins. Oh, why are you eating that way? Oh, chemotherapy, that's harsh. You always want to think positively
Yeah.
about the chemotherapy that you're getting, the surgery that you're going to undertake, or the foods that you are eating, even though they don't taste the best to you. But if you feel like, these foods taste so good and they're going to help me beat this cancer, it's positively going to impact
That's
on
right.
your brain as well as your immune system.
Yeah, so that's a very important aspect of the healing process, your attitude.
Mm-hmm.
And like I mentioned earlier, that the love that people express to you,
Mm-hmm.
it's so important. If you really stop and think about it, you tell, oh, these guys call me up and say they're concerned about your health.
Yeah,
That in itself to tell you something,
yeah.
that
They care about
hey, people care about you,
you.
they're concerned.
Mm-hmm.
So for me, I don't think I could put that on a side.
Mm-hmm.
Because they cared for me, I needed to respond.
Mm-hmm.
How can I not take care of myself when so many people care about you?
Mm-hmm. Okay.
You know?
Yeah, I understand that. I can tell you, I really believe and felt for those people who cared for you. So, Doug, you had great results with naturopathic medicine. Obviously, not everybody is going to, but you had great results with naturopathic medicine. Can you tell us what your impressions are about your recovery. Did you expect to do so well? What's your impressions of naturopathic medicine
Great.
now? That
No,
sums
but
it up, yeah.
yeah, but like I said, earlier, than I repeating myself again, but you gotta have trust. You gotta have trust. And if I may say so, the first trust is gotta come from up there.
God.
And as far as naturopathic medicine is concerned, because he has created all the things for us. So if you can remember that and eat all the food that a naturopath doctor recommends and all those things that was created by him, you're going to be okay.
Yes. God provided everything we need right here.
That's right.
And food is our best medicine, right? Doug, what would you like to say to other people who have cancer right now? And, what they feel about, if they don't know about naturopathic medicine, what would you like to say to people who are suffering from cancer? Okay.
First is that you got to have faith. You got to have hope. And you got to have the desire to get well.
So meaning you have to have faith or hope that you can get well.
Yeah, that
not
you can
give
get
up.
well, that not give up. The thing that I'd like to tell people is that God had created us in such a way that our body that he has created is capable of healing itself. But you must give the tools to do it. Without the tools, you're not going to get it. And the tools come from him too. And that's the tools, your vegetables, all those things. And
Right.
just having faith and believing and trusting in divine power. That, and most of all, having the desire to get well, because if you have that desire, you're not going to cheat and eat the things that you're not supposed to be eating.
Right.
You're not going to do anything that's negative. You're going to do everything that's positive. And good will come out from that. So there's hope. And the other thing is that there's only you as an individual can do the things that you need to do. There's your neighbor or your spouse cannot eat the vegetables for you to get healthy. It's as simple as that.
Yeah.
You got to do it.
Yeah.
You cannot just read and listen and think you're going to be healed. The key emphasis is you got to do the things you got to do. If you don't do it, forget it.
That's well said, Doug. Doug, I want to thank you for joining us and sharing your incredible and inspirational story with us.
It's a pleasure to
on the
be
way
here with you, Dr. Uchito.
All right. I want to wish you the best of luck and continued health and wellness.
Thank you.
All right. Now for the segment that you've all been waiting for, the section on what's wrong with my food. Paul was kind enough to email this to me. His question is, this is my diet. I eat it every day for breakfast. Orange juice, coffee, and my Milky Way bar. I want to know if any of these foods are causing the ulcer pain that I have after eating it. What's wrong with my diet? So Paul, thanks for sending us in. Coffee is a well-known irritant of your stomach. That alone could be causing you to feel the heartburn and the reflux. The orange soda could be causing some irritation because of possibly some acids that are in there, increasing the amount of acids in your stomach, causing the heartburn and the irritation. So what you could change from this, from your diet, Paul, maybe you could, instead of drinking the coffee, maybe try drinking water or possibly green tea. Decaffeinated green tea may help you. The sodas could be irritating you. Maybe try drinking a juice instead. That might help you better, like orange juice. And hopefully with those changes, the heartburn goes away also. Paul, thank you for sending in your your breakfast. I hope you do well. If any of you out there have any questions about your food, please send them into islandwellnesstv@hawaii.rr.com. And if you have any questions about health or wellness, please don't hesitate to send them in at, again, islandwellnesstv@hawaii.rr.com. Now the tip of the day. You may want to take a calcium or bone formula because everybody has a risk of developing osteoporosis, whether you are a man or a woman. Everybody loses the equivalent of 1,500 milligrams of calcium every day. So unfortunately, calcium is not the only ingredient that you need to help calcium get into your bones. So the tip is basically not only take 1,500 milligrams of calcium every day, but also take the right amount of magnesium, which would be between 33 to 50%, depending on what research study you look at, is needed to help that 1,500 milligrams of calcium get into your body, as well as manganese, copper, zinc, boron, vitamin K, and vitamin D. Thank you.